Hello. Do you suffer from lateral, which is outside of the ankle sprains every year or every few months? Lateral ankle sprains are one of the most common things we see in a MSK clinic, and they affect people of all ages and varying activities, from playing sports to simply walking down the street. An ankle sprain in the acute stages can result in pain, swelling, and possibly bruising, and a loss of function. The sudden inversion or rolling in of the foot results in damage to the lateral ligaments of the ankle. And the ligaments that are most commonly affected are the anterior and posterior talofibular ligaments and the calcaneofibular ligament. The protocol we recommend for acute ankle sprains is PRICE. Now, P stands for protective weight bearing. Starting to weight bear as soon as possible after the injury can help to reduce the swelling. You may require a special cam walker boot if necessary. You don't need to weight bear for long periods of time. Even a few steps every few hours is a good start. R stands for rest. We need a balance between protective weight bearing and rest to allow the tendons to heal. I stands for ice. Using an ice pack during this stage of your ankle injury can really help. C stands for compression. Using an ankle wrap can reduce the swelling around the ankle. E stands for early mobilization. After a few days, it's important to move your ankle downwards, upwards, tilt it in, tilt it out, and curl your toes. Chronic ankle sprains occur when there's reduced neuromuscular control of the ankle. It's that feeling that your ankle is going to give way at any time. This happens because of previous injuries, and then there's a reduction in proprioception. Proprioception is the ability of the body to sense motion and position and equilibrium. Other factors include muscle strength and muscle reaction time and postural control. Now, what can a specialist do? Well, diagnosis is the key. We can assess your ankle, identify which ligaments and structures are affected, and tailor a treatment plan based on your individual needs. This will include an exercise program involving a TheraBand, wobble board, and possibly even a foam roller. We'll also look further up your body at your hips. We know from medical studies that some people who suffer from chronic ankle instability have weak hip abductors. If that's the case, we can identify which of these abductors is weak from our examination and give you specific exercises to target these muscles. We can also do mobilization and manipulation of the ankle, especially the talus, which is this bone here. This can help to reduce further occurrences of ankle sprains. Foot orthotics can be an essential part of our treatment regime. Often foot alignment is one of the contributing factors to getting chronic ankle sprains. Custom foot orthotics can help to improve balance using unique postings on the orthotic based on the full biomechanical assessment. In a moment, I will go through a few important calf and ankle stretching exercises that will strengthen the calf and the connective structures. Thank you for listening. To show you is use a TheraBand, or if you don't have a TheraBand, use a towel or even a belt. Place it around your toes and pull your toes towards you like that. You'll feel the stretch in your calf. This is a really great calf stretching exercise. Second thing you can do is, if you have a foam roller, then get a foam roller. If not, then just put a towel under it. Get the band again, or the towel. This time I want you to pull it towards you and gently push the ankle down and then push it back up, and do that 30 times. If that's uncomfortable, then remove it and just do it without a TheraBand at all. After that, it's important you get hold of a TheraBand as part of your ankle rehab. Now, with a TheraBand, what we're going to do is we're going to put the TheraBand around the foot, and we're going to use the other foot like that, and you pull it, and I want you to move the ankle outside like that. It's important you don't move your whole foot and you're just moving your ankle. Do that 30 times that way, and then after that's happened, which is I want you to put your foot over the other one, pull it around and have the knot facing the other side. This time your foot is going to move inwards like that. Do it like that, hold it and back, hold 30 times again. This will help to strengthen up your ankle ligaments. The next exercises I'm going to show you are going to be standing up. The next stretch I'm going to show you is the standing calf stretch. Find a chair or a table, and then what you need to do is put your affected leg behind you, like this. Have both your feet facing in the same direction, and then bend the front knee. Now what's important is you keep your feet facing in the same direction and that heel doesn't lift off the ground. And don't bend this knee either. So the three ways people cheat doing this exercise is, one, they will move this foot facing in that direction, or they will lift up that heel, or they will bend this knee. That's not going to give you the kind of calf stretch that you need. So it's important that you have your feet facing straight, you bend this front knee, you keep that heel on the ground, and you do not bend that knee at all. Do that for 10 to 30 seconds depending on your flexibility. Do it for 3 sets and then do it on both sides.